Devick Technologies Incorporated provides a broad set of integrated technology, evidence-based solutions for concussion screening and management, reading performance, and neurological function.
One of the very unique components of our company is that we have a co-branding equity agreement with Mayo Clinic. According to U.S. News and World Report, Mayo Clinic is the #1 hospital system and healthcare brand in the U.S. They've never done that before. In their 150-year history, have they ever co-branded with another company. There's 4 things that our products have in common. One is that they're all evidence-based. There's been more than 150 peer-reviewed articles published in elite neurological journals in the last 7 years validating our products. Number 2, they're easy to use and they're objective. So they're objective meaning that there's no results that are subject to interpretation. And 3, they're easy to use, meaning that laypersons, moms, coaches can administer the test. They're also electronically transmittable for telemedicine, which means that the results could be sent to your doctor at some other location. And all of our products are SaaS model. What SaaS means is software as a subscription or service, and so there's a recurrent revenue because the subscriptions are annual in nature. Our management team is uniquely experienced. I'm personally the CEO and chairman. I've been involved in 6 separate startups which became public companies. One of the companies which I was involved in starting was called Platinum Technology. From my partner's basement, it became a company that sold for $3.6 billion. Many of you have heard of Blue Rhino, which is propane cylinder exchange. It's another company that we achieved from starting to public company. Blue Rhino is a company that has a well-known consumer brand. As a matter of fact, when we sold that company, it had more locations than Wendy's, Burger King, and McDonald's combined. And that was another successful startup to IPO that we accomplished. All these IPOs are on national market NASDAQ. The CFO of the company, Doug Laux, has been the CFO of 3 separate $1 billion annual revenue companies, in addition to lots of experience in the public market as well. The total addressable market is uniquely large in the fact that, for instance, there's more than 1 billion sufferers of migraine headache across the world, and there's many that have age-related macular degeneration. There's at least 10 million concussions a year annually. Of course, every child that's in early education would be part of our addressable market. So it's a uniquely large total addressable market. The vision for the company is to complete and accelerate our implementation to the market. In other words, have more subjects using us around the world in new markets and existing markets like concussion screening. Ultimately, my goal is always initial public offering. That's the way that we monetize our stock for our investors when we're a private company. Our competitive advantages is that we've spent the last few years being a research and development company. All of our products have been validated in peer-reviewed publications by independent third-party experts. Our IP is all listed and registered and has met all the regulatory requirements for sale. Couple that with the really experienced management team, and I think we have a real edge on many young companies. So our concussion test is called the King Devick test in association with Mayo Clinic. It's used all over the world. It's used by famous leagues like the National Hockey League, Canadian Football League, NCAA teams like Notre Dame and Ohio State, even things like the International Cricket League, the Australian Football League, many leagues and schools around the world. And it's also used in our U.S. military. We were awarded Mayo Clinic's Top 10 Healthcare Innovations in 2018. In addition to that, last year we won the VA Innovation of the Year Award for our work with traumatic brain injury. Because of our work with traumatic brain injury and with the U.S. military, I was asked to speak before the U.S. Senate Armed Services Committee.
But what's the landscape look like out there in terms of options?
Well, right now, it's kind of a 3-legged stool for sideline testing. One is ocular motor function, which is what our test applies to, and one is balance, and then one is cognition, like who's the president, what day is it, those kind of questions. I think that when you apply all 3 of those that can be done quickly on the sideline, you get very high specificity and sensitivity. So as Dr. Miles said, ours is a tool. There's other tools that they should be combined with, but again, the whole suite of tools doesn't take long and it can be done on the sidelines.
The King-Devick test in association with Mayo Clinic is a vision-based performance measure really based on eye movements. I think a lot of parents, coaches, and athletes are looking for tools to really keep their athletes safe and be able to screen for concussion on the sidelines in a reliable way. The only thing is I think that there's a lot of other products that may not be practical or evidence-based. That's one of the things I think that sets us apart as a company is that we have a significant amount of evidence, scientific evidence, to support the use of the King-Devick test on the sidelines.
Another component that's important and perhaps bigger than our concussion screening is that teaching the physical act of reading in schools is important and it's never been done before. When you consider reading and how it relates to these micro eye movements which can predict a concussion very accurately, and we just assume our 6-year-old can efficiently perform those reading eye movement tasks just because we dropped them off at school. And certainly all kids, at least in early learning, benefit from practicing those physical acts involved in reading. In as little as 6 weeks, the remediation or acceleration program we have relative to eye movements in early learners younger than 4th grade can improve reading fluency and comprehension dramatically in that very short period of time. The third vertical of our company involves chronic monitoring of neurological function in diseases like Alzheimer's, MS, Parkinson's, migraine headache, and age-related macular degeneration. Objective tools that caregivers can administer at home are important in knowing when changes have occurred so that they can be referred back to the neurologist or physician and perhaps change medication or take some other course in their treatment. The products we have help people in a situation, for instance, where there's a mom at a soccer practice and no one else as a healthcare provider, and she's able to screen to as whether her son or daughter should be removed from play. What we like to talk about around our office is doing well while we're doing good.
We're back tonight with one of the biggest concerns for young athletes and their parents, concussions. But now a simple 2-minute test done on the sidelines after a head injury is proven to be one of the most reliable ways yet to identify a concussion from peewees to the pros.
A medical unit called all these neurologists who are experts in this area, and they found another test to use called the King-Devick test. It can help determine whether players should be removed from games. But here's an advantage. The test can be done immediately on the sidelines after a suspected injury. It can be done at home as well.
This morning on Today's Health, a closer look at concussions and sports. Serious head injuries are common from pro football to youth sports. Well, thanks to a new mobile app, parents and coaches can test for concussions right along the sidelines.
It's also some, concern about parents right now. Their kid can have a concussion, they have no idea.
So having an objective test has a lot of value.
But right now they do use a pretty simple test that is effective.
There's a simple eye test that many people are using called the King-Devick test.
There are a lot of different ways to look at the neurological function of the patient.
Take the King-Devick test. It begins with a series of numbers. You're asked to go from one
number to the next in a fairly irregular way. The patients that sustained a concussion during the season, their performance would slow down after the concussion.
All new tonight here on the News at 5, the Canadian Football League, the NHL, Major League Soccer, all of them have something in common when it comes to fighting concussions. They all use a very simple and highly effective sideline test.
It's a test any parent can use.
Hi, I'm Dr. Adrian Cohen from HeadSafe, the concussion charity. And we're here at Sydney Eye Hospital to talk about the King-Devick test. Unlike other tests which require a doctor, expensive equipment, or are confusing, the King-Devick test is a more accurate, reliable and accessible method of testing people for concussion.
And has been extensively validated in the medical literature and by the world-renowned Mayo Clinic. The King-Devick test is a visual test based on measurement of eye movement. It tests the speed with which the subject can rapidly read and say out loud a series of single-digit numbers. As the visual pathways represent so much of the brain's activity, changes in visual response following concussion are a good objective measurement of altered brain function. It's an easy-to-administer screening tool and can be utilised by sports trainers and healthcare professionals such as doctors and physiotherapists, both in the office and at the sporting field. It can be used with children as young as 5, and you can log into your King Devick Test online system account to manage data for comparison and reference.
This year we included as part of our concussion protocol the King Devick test, which we started last season. When the athletes are removed from the field with concussion symptoms, we then give them the King Devick sideline test.
Right at the game, if you see a kid take a hit, this is just a way of getting an objective measure in minutes on did they really take a hit, how bad's the hit, and are their scores down from their baseline.
4, 3, 5. I think if we are the stewards of young men that come to our program and parents are going to entrust us with their most prized possession, their sons, that we have an obligation to make sure that we're doing things the right way. I think that's first and foremost.